Hey beautiful souls, Dr. Gold's here. So one of my cousins called me. She suffered with a blood clot and her doctors now are saying she can never be on hormone replacement therapy, including estrogen. So we spoke about this and she's actually having a lot of hot flashes, brain fog, fatigue, trouble sleeping, just a lot of issues that go along with low estrogen levels. And we mentioned topical estrogen. So right now I just want to point out the difference between oral versus topical estrogen. The oral estrogen goes through the liver. It gets broken down from the liver through the first pass effect. When it's getting broken down, it's actually increasing clotting factors and reducing the dissolving of those proteins that break down clots as well. So in a nutshell, when you're breaking down oral estrogen, it actually increases the risk for blood clots because of those higher clotting factors and the ability of those proteins not to dissolve that blood clot as well, because those proteins are diminished. On the other hand, if you have transdermal or topical estrogen, which can be applied vaginally or in a patch form or creams, they actually bypass the liver, which is cool because they get absorbed directly into the bloodstream, and because they're bypassing the liver, they actually don't increase the risk for blood clots. So I was looking it up just to double check, and what the research I found is showing that transdermal or topical estrogen or estradiol doesn't actually increase your risk for blood clots. I usually say start on a low dose topical cream, and you can of course talk with your doctor. There may be exceptions to anything I mentioned. This is not considered personal medical advice, but it's worth mentioning because estrogen has so many beneficial effects. We know it does build up strong bones, so reducing your risk for osteoporosis or increasing your risk for osteoporosis if the estrogen levels are low. It also helps reduce your risk for dementia. There's estrogen receptors in the brain, in the gut, just throughout the body. There's many estrogen receptors, and we know it has a beneficial effect of promoting health, reducing the risk for brain fog. It's also really good for building up, as I said, those bones, and also reducing risk for hot flashes, which can be very not fun. And many people say, Dr. Gold, I feel like I just want to rip off my clothes, or just, you know, the temperature is ridiculously low and I'm still burning up, and it can be very frustrating, and then it affects your sleep, which we know that can affect your memory as well and overall health. Because if you're not sleeping, you're less likely to do the next day's assignments well. Could be a little more irritable or moody. So big picture, estrogen, the proper estrogen, we want the bioidentical hormones. I'm a big proponent of that. Use safely for your body. Of course, discuss this with your doctor. But the transdermal, in the research I've looked at, has not shown to significantly in low doses topically increase the risk for blood clots. So it's worth discussing with your doctor. And if they say absolutely not, because in the case of my cousins, she actually said she went to one doctor who said your estrogen is really low. At first they weren't even going to check it, but we were talking and she's like, I want to get my hormones checked because I was mentioning that it should be done. She saw how low, and they're like, yeah, you should be on estrogen. And then so that was her primary. And then she said, well, I need to get approval from the other doctor. So the OBGYN also agreed. And then the other specialist she was seeing, the neurologist, said absolutely not. So, and I just said, you know what, just provide proof, explanation. So from studies, why they're saying no. Because if there is more research to say that transdermal topical estrogen actually increases your risk for blood clots, of course, I wouldn't suggest it. But if there's not actual studies or it's a theoretical risk, then you have to decide on that for you. Does that make sense? So Dr. Gold's here. Remember, your health matters. Toodles. Mwah.